So my name is Spencer. I'm a physical therapy student, and today I'm going to be examining this wound. So the first thing I would do is not just treat the wound, but treat the entire patient. So I'd ideally go through the patient's medical chart and try to figure out what the cause of this wound is, and then ask the patient questions so we can prevent this from happening again. One of the main questions I'd have to ask is how this wound happened. So just starting off, looking at the wound, I see that it's on the medial lower leg. I see that around the wound there seems to be some darkness, probably hemosiderin staining. Again, around the wound I see drainage right here. It is copious in amount, that means there's a lot. It is serous or yellow in color, and it's watery. Again, around the wound I see that there's a little edema here, so I'll press down for 5 seconds just to quick assess it. When I lift up, if it's pitting, there will be an indentation. If not, then it's non-pitting edema. So it's non-pitting edema around the wound. Another thing I'll do is check the pulse at the ankle. Is 1+, which is decreased. 2+ is normal. So that's another sign that I can use to assess it. Just looking at the location of it. I will say that it is 11 centimeters superior to the medial malleolus. Now I can measure the wound itself. So using the 12 o'clock method, or the clock method, knowing that up here is 12 o'clock towards the head, down here is towards the foot, 6 o'clock. So measuring from the top to bottom, straight down, 5.9 centimeters, measuring straight across, 6.4 centimeters. So that was 12 to 6 and then 3 to 9. And now I can measure the depth of it. So ideally and something I should have mentioned, this patient has an allergy to latex, so I'm using vinyl gloves. To measure the depth, I would go with the deepest part. It looks like it's deepest around this 6 o'clock area, maybe 5 to 7 area down here. So if I had an instrument that had a measuring tool built into it, I would use that. For this video, I'm just going to use this pencil. So I would go into the wound, then pinch off where it meets the surface, and then measure that off. And we're looking at about 0.5 centimeters. Again, I'm using just a goniometer to measure. If this was a real patient, I would use a disposable ruler so it wouldn't get infected. Okay, so now I just look at the color of the wound. So most of it is yellow here. There is some redness here, and some black here. So it looks like it's about 75% yellow, 25% or 20% red, so that's 95, and then the rest of 5% black. And this looks like necrotic tissue. Now, necrotic tissue doesn't necessarily mean it's infected, but it is a good place it's a breeding ground for infection basically, so we would have to keep an eye on that and hopefully remove that from the patient. I don't know if I mentioned the drainage yet, but there's a lot of it. It's copious in amount, and it's yellow, serous, and watery. There is slough in the middle. It's kind of the same consistency and color. It's yellow, and you wouldn't be able to pick it up if you tried. So that's slough across the majority of the wound. The bottom looks like an epibole. That's where the epithelial cells don't march across, but they march around the border, and then they meet up down here at the bottom. And that's another reason why we have the undermining here. And I would also check for tunneling through the back or another location of the wound or of the foot to see if it went all the way through. Doesn't look like anywhere it goes all the way through, so there's no tunneling, just a little bit of undermining. And the wound edge is distinct. You can tell it's different from the peri wound. It is not attached. There's a epibole. And like I said, with the peri wound, there's hemosiderin staining around it here. There's edema. And I would check for an odor for this wound, so I would rinse it clean, so that way I just get a pure smell of the wound itself, and I would waft it towards my face. And I'm not smelling anything right now, so that's a good sign. And then lastly, I would just look at the temperature of the peri wound. So I'd use the back of my hand, and I see that it is a little bit warmer than usual. That is probably because of all the edema in the area. So looking at this wound, I would classify it as a venous wound. You know, medial side of the leg, edema, decreased pulse, hemosiderin staining, irregular shape, all those factors. And that's what I would tell my patient.